Well, when it comes to COVID-related policies, a number of significant changes have been made in the past week. For starters, much of Ontario is now in Phase 3 of economic reopening. And in addition, the Thunder Bay District Health Unit made a significant announcement last week. It's decided that it will enact a mandatory mask policy for the district starting this Friday. Dr. Janet DeMille is the Medical Officer of Health for Thunder Bay. She's on the line. Dr. DeMille, good morning.
Good morning, Amy.
Thanks for joining us again. So the last time we spoke, the health unit was still, I guess, in the process of making a decision. What ultimately tipped the scales in favor of a mandatory mask policy?
You know what? It was certainly a number of things that informed that. I mean, you're certainly looking at reopening, and I knew that even a couple of weeks ago that we would eventually go into stage 3, and I was not surprised last week, of course, when that was announced. But just considering what the impact of reopening and more businesses being open and more opportunity for us to be able to interact with one another, where the virus could potentially transmit, I was very carefully following and have continued to follow what's happened in other jurisdictions, especially in Canada around reopening. So when they open businesses, and there are unfortunately increasing number of cases of COVID-19 that are associated sometimes with businesses that have reopened and such, and that can have certainly very significant impact on a community. So aside from thinking of stage 3 reopening, I was also thinking about the fall and preparing for the fall. And I do, of course, we're, hope for the best, but have to plan for the worst. And certainly when it comes to looking forward, these are uncertain times, but it is quite likely that we will see an increase in number of cases then, and more community spread that could be quite significant once again for us. And I was also sort of thinking about schools reopening, lots of conversation, lots of talk about that, and recognizing that seems like it's just around the corner in many ways. And really wanting, we have been so successful at keeping the virus very low in our area in the recent weeks, for sure. I mean, we couldn't, we're in a very good spot right now, I think. But we don't know what we don't know. I can pretty much guarantee that the virus is still there. We're just controlling it. So all of these things, the approaching of the fall and the cooler weather, the reopening, which is going to allow us to gather, and then what was happening in other areas. And I should mention as well, I'm concerned about the states and what's happening in Minnesota. And I felt that what we really, in looking at the evidence around masking, and, it is one additional measure that we can all take to be able to keep the virus, to control the virus, to reduce its spread in the communities. That will allow us ultimately to keep businesses open, to be able to still gather together, physically distancing, of course, and to optimize the success of school reopening when it happens.
So the policy is for enclosed public spaces, and people might be wondering just what that means. Can you give me some examples of what would count as an enclosed public space?
Yeah. You know what? It's a fairly broad. It captures a fairly broad thing, and if you read the letter of instructions, there's some additional information on the last page of that. But certainly all retail outlets, like you were talking to the individual from the mall recently, that would be an enclosed public space. Restaurants, bars, of course, fitness facilities that are going to be reopening, all personal services settings. Even if we see the reopening of community centers or businesses that you could walk in and be served. Even the health unit here, where we have controlled access right now, but if we open the doors, then we would the reception area, the waiting room area, because basically people could be able to come in. So it is a wide variety of places that are included as part of that.
How will the policy be enforced?
Well, I'm reluctant to talk too much about enforcement right now because really what this is wanting to promote this and wanting to support businesses and everybody who is an operator of enclosed public spaces to be able to implement this. And we've done a lot of work with businesses that are reopening and actually other spaces that are reopening. And our approach is very much that supportive approach to really, answer questions, provide that support, provide that guidance and that direction as businesses sort of implement all the measures that they need to take as part of the reopening. So, and the mask order, the mask instructions are sort of one of that. And that is my approach. And it's not just about the businesses themselves or the operators of those. It's really at this time encouraging everybody to really, participate. We all have a responsibility in the success of this and the other measures that control the virus, and encouraging everybody to, have that face covering available, that mask that they can use when they go into those places. We do still get, we have a complaints line. We do get calls, whether it's related to masks or whether it's related to other things, and we do follow up on that. But often it is really ongoing, continuing to support those businesses in implementing all of these measures. And what we find actually when we do get, let's say, a number of complaints about a particular area or particular facility, when we do follow up, it's often not the issue of the actual business itself. It's that people aren't following the rules or the direction that the business has set up. And so, we all have a responsibility in ensuring this. And that's our approach for right now.
Because I am wondering if you have a legitimate reason for not wearing a mask. Is there anything you need to do, or are you asking businesses to just be understanding?
Yeah, really, this is about, so that's a very good point, Amy. Thanks for bringing it up. There are reasons why people cannot wear a mask, and they don't need to wear a mask when they're in those. What we're asking businesses to do is to, approach people and to talk to people and remind them when they come in, and somebody who has an exemption or who qualifies for that just needs to indicate that they're exempted. They don't have to provide proof or explain that, and I think we all need to be respectful of that. So there are certainly exemptions to this.
Dr. DeMille, just quickly, I wanted to ask you about another change that's been made. So the province no longer requiring people doing outdoor visits at long-term care homes to take a COVID-19 test. Would you recommend that people continue to do it anyway?
Not at this time, no. I think what's been shown, because this has been kind of followed up, I think it's been shown that there's really minimal risk, especially with outdoor visits. And I think there was a lot of testing being done and a lot of, the results weren't significant of that. And outdoor spaces, the virus doesn't transmit very well outdoors. So I think actually this was a good move. We were seeing a lot of people needing testing before they attended the visits to their loved ones and family members at long-term care, and it was causing an extra burden on them, and they've already experienced such a challenge being restricted from visiting. And I don't believe there was anybody that was positive in our area related to that, and so and it was actually creating a backlog in the tests. So that I think is quite reasonable. We continue to recommend really anybody who has symptoms, even if it's just a mild symptom, to get tested. That will be that is a way of helping us continue to monitor the level of COVID in our area. But certainly, if somebody doesn't have any symptoms, if they abide by all the other measures that are put in place by long-term care homes to make sure those visits are safe, then they don't need to get tested.
Dr. DeMille, as always, really appreciate your time this morning. Thank you.
Thank you very much, Amy.
Dr. Janet DeMille is Thunder Bay's Medical Officer of Health.